Time now for Restoring the Soul of Healthcare from the HELPcare Clinic in Austin.
It is that time for us to check in with our friends from the HELPcare Clinic here in Austin. We say good morning.
Good morning, John.
Yeah, good morning.
Lee Aase and Dr. David Strobel joining us. And boy, we have a lot to cover today because you've got a huge announcement to make.
Yeah, we're excited that as of today, we're going to be announcing that HELPcare Clinic is opening appointment availabilities in Rochester in addition to Austin. So it's pretty exciting that we've been able to work out an agreement with a chiropractor office with Southwest Chiropractic in Rochester, Minnesota. Dr. Bob Gustafson is the chiropractor there. And we've made connections with him. He really believes in what we're doing here and is giving us an opportunity to get some space within his clinic as a place where we'd be able to see patients in Rochester as well.
Is that the type of thing, obviously people over there could take advantage of all the great things that you have to offer, but say I was a member and I happened to work over in that area, that I could access the clinic there, just make it a little more convenient?
Right. I mean, this is all under one ownership with Dr. Dave Strobel as the major owner of the clinic. And so, yes, it will be another instance of what happens here. I do want to just temper the expectations a little bit in that we're starting much smaller there,
sure.
Starting with renting one room within that chiropractor space, which interestingly is kind of how we thought we might be starting in Austin originally, but things worked out differently in that we were able to get this nice, spacious place, at 308 4th Avenue Northwest here in Austin. But in this case, we were able to get that space. We'll probably be opening 1 or 2 days a week at first. But also for the first folks that are signing up from the Rochester area, it'll be primarily telemedicine. It'll be a less convenient schedule than we have here in Austin right now. But for the same reason that we offered the founding member rates in Austin, we'll be doing the same thing in Rochester. That because the people who are joining earlier are making it possible for those who are coming later, and recognizing it's a little less convenient at first, they'll be able to lock in those reduced rates as a founding member, very similar to what we had here in Austin about a year ago.
I just have a feeling, just based on the history that we have together talking about the HELPcare Clinic, that once you guys get started, this is going to continue to grow over there, obviously slowly and as you are able. But that is a really big deal. Congratulations.
It is really a big deal, and it has moved a great deal faster than we really even anticipated. We were thinking that, gosh, wouldn't it be neat to open up another location a year after we'd opened the first one, and here we are talking about doing it, within 10 months after the first one. That's just amazing, And when we first started here in Austin, I was, of course, the only practitioner, and I was just seeing patients on Friday and on Saturday morning. And so we were at just a day and a half a week, and that continued for a fair period of time before we were able to begin to expand that a little bit, and now I'm here Wednesday, Thursday, Friday, and Saturday morning. And then later on this year, my previous position will be ending. That's an arranged thing, so I will no longer be unavailable, and I'll be more available here, and I probably will staff the Rochester clinic perhaps one of those days, because we want to, provide this kind of practice in other locations, but we don't want to do it in a way that's like the other practices that people are not all that happy with, and that is that you always go and see somebody new and you never see the doctor you have a relation with. So we don't want to away, and suddenly you have folks that have had a relationship with a practitioner, and now that practitioner is in another place, and they can't see him anymore. There will be some of that, but it's not going to be the emphasis. We're going to do everything we can to really minimize that effect.
And I like that you really kind of let your membership and really time dictate how you expand and how fast you move forward to make sure you're doing it the right way.
Right. I mean, that's the idea that we'll probably start out with a day or two a week at first. Once we get to sort of a critical mass over in Rochester, where we're able to start having in-person appointments there. But in the meantime, as people are joining early, they can do telemedicine with Dr. Dave or with Stephanie Kimmas, our nurse practitioner. Our blood draws for the labs will be over here in Austin, and so, again, it's a little less convenient than it will eventually be, but we're trying to do it in a really orderly way that would, not get ahead of things, but we're just excited that that this has been able to come about much more quickly than we had expected because of finding a like-minded landlord over there who's interested in working with us and having that practice be represented over in his space.
Yeah, it's amazing how when you're doing the right things for the right reasons, things just kind of work out. Before we run out of time here today, we do need to talk about this open enrollment period, and I know you're passing out and handing out great information to help get people up to speed on just what they're looking at for the next year. So let's talk about that for a little bit.
Sure. With our open enrollment workshops, preparing for open enrollment, we're providing information and some and just an opportunity to have a conversation for folks who are interested in knowing more about HELPcare Clinic and how it works, but also how it works with insurance, because while we don't take insurance as a means of payment, and that helps us to keep the costs lower, people do need to have some way of paying for the big catastrophic unexpected expenses. And so giving them some assistance in navigating through the system and making their choice of what kind of other insurance that they have would make most sense for them. In many cases, by taking a higher deductible plan, they'll be able to save enough on their monthly premiums to pay for much or maybe even all of the cost of their HELPcare Clinic membership. And so giving folks a chance to sort out how that works through these workshops we're having, and also just having them, stop by and have a conversation about it. We can kind of talk through, Monday through Friday, 8 to 5 and 8 to noon on Saturdays here as well. But we're holding these workshops tonight and then next Thursday at the Hormel Historic Home. It's just most people know where that is. It's just it's a block from our clinic location, a couple blocks from Pacelli, a couple blocks east of Pacelli. And so we're having these gatherings at 7:00. We're done by 8 or 8:30, but just a chance for people to sort of sort this out for themselves and get some help in figuring out how insurance works together with this.
Yeah, like everybody says, my dad used to say it all the time, knowledge is power. So find out how this all works and could very well be very beneficial for you.
Absolutely.
Yeah,
it's been the conference that Lee ran last Thursday was really very helpful. We had some people there, and I think there will be probably more folks there this evening, and I'm really looking forward to that. It's a good place to ask questions and to get those kinds of things answered.
Well, the other thing that's really helpful is that the people in the group, the people who are attending, also are bringing their own knowledge about things, their own perspective, and some of them were able to share some of their perspectives with, for instance, some of the health sharing plans, and that's just been a good. It's a good resource when you bring people together who all have their own perspectives and experiences. We all learn together.
Absolutely. We are way out of time. Real quick, let's just remind people your website, contact information if they have questions or want to learn more.
Sure. Go to HELPcare.health or give us a call at 507-279-2345 or stop by and see us at 308 4th Avenue Northwest. It's a block east of St. Augustine's, and we'd love to tell you about how HELPcare Clinic can be of service.
And again, congratulations on your big news, and have a fantastic week. We'll talk to you next Thursday.
Thanks very much, John.
Thanks, John.
Thank you. Bye-bye.